I connect patients to resources both inside the health system and community resources. I am a mom of 4. I'm also a student at UNCG, and I work at Atrium Health, Wake Forest Baptist, with the Office of Cancer Health Equity. I am now primarily focused on creating access to care and pre-diagnosis and screening patients. Oftentimes when I receive patients, when I meet patients, they're going through or about to go through one of the most difficult things that they will ever have to do in their entire lives. And helping navigate that on top of any sort of like social drivers of health or financial difficulties, it kind of all goes together. Often with patients that are facing this diagnosis, connecting to resources, it's not as simple as saying, here's the number, here's the resource. There's an emotional barrier there too, because if you're worried about when your next appointment is, how you're going to get there, what the results are going to say, and you also need to pay your rent, and you also need to feed your family, taking that time to fill out applications, taking that time to go to appointments that are not medical appointments. Will you have to miss work that day? If you miss work, where does the income come? How do you replace that income? There's an emotional barrier, and oftentimes they say, you know what, I can't do this. And then it just kind of creates this heaviness. So I try to alleviate that part, that emotional commitment that people often have to make for these charitable organizations. And I know that because I've been there. You know, like I said, I have 4 kids. I was in the service industry for a long time, and I've had to go to these appointments. I've had to, go stand in a line somewhere. And sometimes it's a choice between how much emotional availability do I have to be able to do this or be able to cook a dinner for my kids? So I try to alleviate that part and make it a little bit easier for them to connect with resources, but then also empower them to take it from there. When I can see the connections being made and I can see the solution, that's my favorite part, is being able to see that and say, okay, we did it and you've got this, and you're a rock star, and now you know what to do from now on, and call me if you need me. But just seeing them kind of have more availability, personal and emotional, because some of the barriers, those initial barriers, have been alleviated. So yeah, that's my favorite part. I am a financial health first responder.